I am Dr. Munishwar, ENT surgeon working at Gandhar ENT and Dental Hospital, 3rd Cross, Someshwarpuram, Tumkur, Karnataka, India. Now I am going to explain briefly about adenoid problem or adenoidectomy operation. So what is adenoid? Adenoid is basically it is a part of the lymphatic system present behind the nose. Here, exactly behind the nose, the deeper part where the nose joins the throat. That is called nasopharynx. It is present at birth and gradually goes on increasing in size between 1 to 3 years. It will reach the maximum size, and then gradually it will go on decreasing in size and totally disappears by 11 years, but sometimes it persists. Okay, and why it increases in size? Sometimes abnormally it will increase in size. Why? Because of recurrent infections in the nose, allergy, then reflux. I think you know all the three factors, three things. That is, allergy is something abnormal reaction to the environmental the irritants or allergens, and reflux is when you eat food, suddenly the stomach contents can come to the throat and then go to the nasopharynx, and because of that the adenoid tissue can become large. So when it becomes large, it can create problems. So what are the problems you get because of the enlarged adenoids? You get recurrent infections in the nose, nasal obstruction or breathing problem, or mouth breathing. Then you also get ear pain, ear discharge, a deafness, and sometimes even recurrent lower respiratory tract infections or cough. So most of the time the child will present like cough and cold problem. How do you diagnose this problem? How to diagnose this problem? There are many methods. The most important method is a suspect, a child with a nasal obstruction, snoring. We have to think the possibility of adenoid enlargement. Okay. And how to confirm? The best method is nasal endoscopy. You just pass a telescope through the nose, you go to the nasopharynx and examine the nasopharynx. You can easily visualize and confirm the presence of adenoids. The other methods available are, you can also do X-ray nasopharynx, you can do MRI scan and CT scan. And once you have diagnosed the child is suffering from adenoid problem, what is the treatment? The treatment is basically two lines of treatment. One is medical and surgical. So medical treatment is nothing but conservative treatment. And what do you do in medical treatment? So we give anti-reflux measures, we can give anti-allergy medicines, antibiotics, decongestants, and general improvement in the health habits. You know, if you improve that, probably the adenoid problem may come down. Like this, the simple medical treatment you can continue for about 2 to 3 months. Imagine the child does not improve with your medical treatment, then the option is surgery. So surgery is done in the age group of 1 to 3 years also. The main age group, that is the main age group where the child will present to us. So that is time where the problem comes and we may have to, if our medicines do not work, then option is surgery only. So how do you do surgery? Surgery is done by completely anesthetizing the child, that is general anesthesia. With endotracheal intubation, they will put a tube from mouth to the trachea and they will anesthetize the child. Once it is anesthetized, we put a clip to the mouth and keep the mouth open, and we also pack the larynx, and then we pass a telescope from nose to the nasopharynx and see through a high definition camera in the TV monitor, and you can confirm the diagnosis. And once you are confirmed, there is an instrument called microdebrider. We pass it through the mouth and go behind the soft palate and reach the nasopharynx. Once you go there, with the debrider machine, we can go on removing the adenoid tissue. Once you remove, the last bits of tissue can be removed with the coablator, and you can achieve the hemostasis by coablator. And normally once you do a complete removal of the adenoid tissue, they won't have any problem. there will not be any problem. But what are the side effects of the operation? One is they can develop bleeding post-operatively, but proper surgery and proper post-operative care, usually they won't get any bleeding problem. Another problem can be you can get velopharyngeal insufficiency or rhinolalia aperta. That is usually transient and it doesn't develop provided you don't damage the muscles. If you want, you can leave small tissue of adenoids at the passivant's ridge. Normally, the child has to get admitted for 2 to 3 days in the hospital, and the child recovers completely about 15 days, and after the 15 days the child can get back to the school. And for 15 days you have to restrict the sports and other physical activities, and food habits post operatively it is almost same normal, and child may have slight pain, otherwise there will not be any problem. And normally once adenoidectomy done, usually it doesn't grow back. If you are completely removed and you taken care of the reflux and allergy, generally they won't come back. And normally they don't have any complication also. And this surgery is also done sometimes even adults. Once it persists beyond 11 years and create problem, even I have seen in age group of 20, 30, 40 years patients I have seen adenoids creating problem for the patient and coming to us with breathing disorder. Now I will show in atlas the where exactly the adenoid present. I think you can make out this picture. This is brain, this is nose, this is tongue. So if you see, this is a nose and you just go just exactly behind, you see the red color stuff what you see. I think you can make out. This is the spot where you get adenoid present. Even this picture you can see there, see the presence of are marked with the red color, that is adenoid. You can make out that. Okay, so the most important instruments required for this type of an operation is number one is endoscope with high definition camera, a microdebrider, endoscopes and coablator. We have all the machines required for doing this type of an operation, and you can confidently undergo the operation. There will not be any problem for the child, and most of the problems will be solved by adenoidectomy. The proper selection of the case is very important. We have to choose. If the child has got isolated adenoid problem, the child will be relieved of their problem. If the child has got additional problems like sinusitis, like turbinate hypertrophy, deviated nasal septum, then the symptoms may not go completely. Thank you.